I'm Derek Johnson, President and CEO of the NAACP, and I have the honor to join me in a conversation with John Stankey, the President and CEO of AT&T. Welcome, John.
Derek, thank you. It's my honor to be here, frankly, so I'm delighted to have the opportunity.
But we want to have a conversation with a few corporate CEOs, and for the NAACP, one of our longest standing partners has been AT&T. I want to start by, first of all, give you an opportunity to tell our delegates a little bit about you and your journey to the position that you currently hold.
Wow. Well, it's been about 35 years in the making, and my legacy and history started with divestiture AT&T in 1984, and have worked my way through a variety of different roles and capacities, mergers and acquisitions, and various jobs, and seen an amazing ride, frankly, in terms of the changes that have occurred with technology, our employee body, and frankly, the company and the culture of the company. So it's been a ride of a lifetime for me, and very blessed to have had the experience thus far, and really excited about what the next couple of years has in store for us.
Yeah. So we are in the midst of a unique period in time. No one could have predicted this time last year, or quite frankly, 6 months ago, that we'll be sitting in the midst of a health pandemic, the unfortunate event of George Floyd, and witnessing what took place, to a recognition that structural racism actually exists by many individuals, but particularly corporate America. Why do you think that recognition is being brought forth now?
Well, I think clearly the social unrest that occurred following George Floyd, and frankly, other, well-publicized murders and circumstances around members of the Black community. And I will tell you personally, I'm nearly 60 years old. I'm not quite there, but if I were to think about my own personal learnings in the last 6 months, they probably outpace what occurred in the previous 60 years of my life. And I think if there's an understanding, then there's a willingness for people to commit to change. And I believe, generally speaking, there are more people who understand the deeper issues of the systemic racism that is in our country. And frankly, my understanding of kind of the roots of how a lot of that established itself and how it's been propagated through the years is far better than it's ever been. I don't pretend to be an expert. I don't think my learning is done, but I think those events created this moment where people chose to engage. And when you get to that level of understanding, then comes commitment. And the commitment is now to move forward and try to quicken our pace of change and get ourselves to a truly equal and just society.
AT&T for many years have been seen as one of the companies that always moved in the right direction when it came to diversity and inclusion, particularly for African Americans. But you've had many acquisitions of companies that, quite frankly, may not have had that same culture. How do you view diversity and inclusion, particularly for African Americans, under what I'm calling the new AT&T, with all of the mergers and acquisitions?
It's a really good observation, and it's a good question, because you're right. I think every acquisition we've done, you find a different set of circumstances in play, and you have to step back and think about what you want to do. And they all start with a very similar formula, which is you have to, first of all, ask yourself what your principles are. And we stand for equality at AT&T. And while we know in many of our cultural tenets, sometimes we fall a little short, but we're always aspiring to get to that level. And you evaluate where that new company is relative to your expectations in that regard. And you have to do that in a clinical assessment of data and evaluating circumstances. Once you do that, you try to get yourself to a point where you build a plan. It says, if this isn't what I like, and this isn't acceptable or isn't consistent with what we've historically done, what are the things that we want to do? And then you have to hold individuals accountable for achieving them, and put with that accountability a degree of transparency, usually data or information that comes to support their responsibilities. And when you get that formula together, I think you can make progress. And look, I'm proud of what our company has achieved, and I'm proud of our progress, and proud of much of the recognition we've received, but it's really clear to me over the last 6 months that while we've made progress, we haven't made enough, and we haven't made it fast enough. And so, even in that context, we're redoubling our efforts. We finished the Time Warner acquisition. We were the first in the industry to put in place, a diversity and inclusion construct around how we chartered new projects in our theatrical division. And that was designed to not only enhance the involvement of people of color behind the camera, but also in front of the camera. And these are things that we will push and continue to push because they're consistent with our history and our desire to make change. We've just got to start figuring out the right ways and taking the right actions to redouble our efforts. And I'm really pleased with some of the things we actually have underway in that regard.
So what do you see as the next step for AT&T in the areas of diversity and inclusion? You've assessed, you've implemented a plan. What do you think will be the next steps?
Well, we're going back on some of the things that we know have worked really well for us, but we're also asking what are the new things we need to do. And as I shared with you, I just think about my learning and the reason I have motivation. It's accelerated dramatically over the last 6 months. And one of the things I've asked the organization to look at is I had the motivation to go do that. I went and had some great people who were kind to sit down, spend time with me, tell me about their life experiences, was able to read, get some good references on things that I was able to go and explore and understand. Now, how do we get all employees at AT&T doing the same thing? Going through their own education process, developing that understanding where they develop the commitment to move this trajectory along faster and quicker. And so we've done some things around changing what we do for awareness training and the kind of resources we're using and how we're having employees and work groups go about it. We're stimulating dialogues inside of AT&T to ensure that some of these hard conversations that lead to accelerated learning are occurring. I mentioned transparency and data. We already shared, as you know, we used to sit down annually with you and talk about our progress in key areas. You've now seen that what we put out publicly is even a deeper exposure of the data and the information of how we're operating the business in terms of individuals in key leadership positions, how we populate particular parts of our business with people of color and women. All that is really, really important to us. I think that transparency is what gives us the responsibility to find other things to move further along. And so all those things together, I think, will help move our pace along. We're doing an awful lot on the recruiting side as well, ensuring that we've got the right relationships externally with the right talent. We've taken some of our best apprenticeship programs and we've doubled our resources around those to bring people in to give them an opportunity to learn about our business and ultimately have meaningful and gainful employment. And then last thing I'd mention is we're engaging externally with the community in ways we really never have done before. I'd be happy to talk a little bit more about that, but we're now starting to think about not just what goes on within the four walls of our company, but also what we're doing outside the four walls of our company.
Yep. So, when you look at employment, that's one key metric, and it's an important metric. When you look at executive opportunities, that's one key metric. Another key metric is procurement. We have a lot of our members who are very interested in how can they be a supplier to a company like AT&T. What would you recommend?
Well, as you know, we have a very robust procurement program that represents a variety of different special interest organizations and is designed as well to make sure that we put equity in society broadly. And I think we've got probably, I would consider the leading program in the United States around that. Have had great success. We have a liaison within our procurement organization for any African American, any diverse veteran organization that wishes to come in and do business with us. We will take special steps, try to bring you into the ecosystem and talk about opportunities to do additional work with AT&T. I would tell you in the last 5 months, one of the areas we focused on very carefully, what we've been able to do within the financial community with Black-owned financial organizations. As a large business, large balance sheet, company that does a lot of transactions in a given year, we have a lot of different relationships in the banking community. And we've worked really hard over the last several months to find new avenues to do that. And I couldn't be more pleased with the progress that the team has made. For example, in our most recent bond exchanges we've done, several $100 million of commissions have gone into Black-owned enterprises to support them. And one of the things we're now working with that community to help understand is there's been a bit of a windfall and some good money because of these transactions that we brought forth, and we're encouraging them to use it to actually build their balance sheet as opposed to kind of disperse it out to their various shareholders and themselves. Because if they use it to build their balance sheet, it opens the aperture of other business that they can be competitive for than AT&T. So good thing has happened, even more good things can happen moving forward on some of our more complex transactions if this windfall can come in and actually help them build capital structure differently. So, we take that very seriously, and we're very active in those areas, Derek, to try to move forward. Whatever the NAACP can do to help us get that word out and expose us to those individuals who we can work with, we're always open to listening to that.
Absolutely. So you have been in a position now, was it 5 months, 4 months?
It's been a little less than that, but who's counting? It was July 1st.
July 1st, yeah. So, you come from Media, you in this seat now. If you close your eyes and you woke up and it's 2024, what would you like to say, this is the things that I've done?
Well, one of the things I would tell you is with, partnerships with organizations like the NAACP and moving this trajectory forward, as I just mentioned, I'd love to not be having these conversations anymore. I'd like to be at a point where we step back and somebody said, we've moved so far and things are in such a great place. We don't need to be talking about what else needs to be done or why haven't we made progress at the rate that we should. People look back and say, wow, to your point earlier, there was a watershed moment that happened in early 2020 that kind of turned the tide and brought people to a different level of understanding and a different level of action. We all stepped back and said, this thing is on the right trajectory and the right track. I'm not naive. I don't think we're going to have all these complicated issues of race and bias fixed by 2024. But boy, I sure would like to be on a different plane and a different trajectory of pace than what we've historically been on, and can say maybe some of the easier low-hanging fruit issues we made really good progress on. One of the reckonings I had coming through the last several months is I sat down and talked with some of our employees and listened to their experiences of living in the same community I live in, and how different as a Black individual it is in their households, their children, with their own behaviors and their own decisions that they make, and their safety and their confidence of being able to live in the community in an equitable and just fashion. And to sit and have those conversations and realize that you can't take that for granted, that I run a company that pays tax dollars in these environments, that makes a decision to set up our business in these communities, and not have people that I'm fond of, that I trust, that I work with every day, come in and have the same experience I have. Is just, it's very unsettling. So, if we could make progress on that, where we're in a situation where our employees come in and feel no different than I feel, driving to work every day and driving home every evening after they've worked late, back to their homes, that their children can go out in society and feel that they can be treated the same as my children can. And as an adult parent, I don't have to worry about what they're out doing late at night. If we can get progress around things like that, I'll be very, very satisfied. And no, we won't have fixed everything. We may not have solved all the equity and education issues and access to healthcare issues. Boy, we should be on a better pace and a better plane than what we've been on the last 10 years.
Well said. So any final thoughts you want to share with our delegates as we prepare to conclude the convention?
What I would say, Derek, is our relationship, as you pointed out at the front of this, has been a long-standing and productive relationship. And it's because of the reach of the NAACP and what you're able to do is so much more than what a corporation like ours can do. We have a very important role in society and a very important role within the walls of our business to ensure that we bring quality and justice to all of our employees and the environment that which in the society we work in. But we're but one voice. And when we can work collaboratively with the NAACP, you're a coalition of voices, and that's what you do so effectively. And if we can work and continue to work together collaboratively and constructively, where you bring that coalition together and amplify it, and you bring your expertise in the council and constructively engaging us, those areas where we fall short of our own principles and our objectives and our cultural aspirations, then I think we are going to find a way at this time to accelerate our progress. And as delegates and as members of a great organization that has done wonderful things for civil rights in the United States, I think we've got this unique opportunity to build on what's worked well, but do it at a different pace. And I'm really excited about that happening moving forward. I appreciate the opportunity to chat with all of you today.
Great. John, thank you. This is our 111th annual convention. Thank you for joining this conversation. And hopefully next year, we can invite you and we can have this conversation in person. So thank you very much.
I would agree. Derek, thanks for having me in.
Hello, NAACP family. My name is Michael Curry, member of the National NAACP Board of Directors and former president of the Boston NAACP. I want to bring greetings to you today from the great city of Boston, Massachusetts. We're sorry that you could not be here in person with us today, this week, as we celebrate and participate in the 111th annual convention of the NAACP. However, I wanted to take a few moments to share some history. We have a lot of history in Boston, some good, some bad. We're still dealing with racism and discrimination in the city. But I wanted to share with you that in 1700s, Phyllis Wheatley wrote her poetry right here in Boston. It was here in Boston that Prince Hall launched his campaign to create the Freemasons. It was here in Boston that the 54th Regiment organized to participate and fight for their freedom in the Civil War. A monument that exists right downtown in Beacon Hill. Beacon Hill, a community that was populated by Black citizens in the Commonwealth, a place of refuge for slaves from the South. It was here in Boston in 1915 that D.W. Griffith was coming to launch his film, Birth of a Nation, and William Monroe Trotter led a march on downtown Boston of over 10,000 African Americans to protest that film. It was here that the NAACP had its first chapter. You may not know that there was an organization in Boston called the Boston Committee to Advance the Cause of the Negro that organized here, that in 1911 would become the Boston chapter of the NAACP. By 1912, would receive their official charter at Park Street Church. But again, we hope you enjoyed the 111th convention, and it's great to have you participate, and thank you for your service to this civil rights organization.
Good evening, fellow delegates and alternates. My name is Hazel Dukes. I'm chair of the National Nominating Committee. I will be presenting rules for persons who would like to be elected to the board of directors. The deadline to receive consent forms for a candidate to the National Board of Directors at the National Convention will be September the 18th by email at ballot@naacpnet.org no later than 10 a.m. For candidates wishing to make speeches, the official nominating speech reservation form must be submitted to the chairman of the election supervisory via email at ballot@naacpnet.org no later than 10 a.m. on Monday, September the 21st, 2020. Nominating speeches will be no more than 3 minutes each and no more than 1 seconding speech of 1 minute. These videos should be sent with the complete nomination speech reservation form and submitted via email at ballot@naacpnet.org no later than 10 a.m. on Monday, September the 21st, 2020. Only a certified voting delegate to the National Convention may place an individual name in nomination or second a nomination. Qualification: NAACP Constitution, Article 4, Section 3. Any member in good standing of the association who has been a bona fide member for at least 180 calendar days prior to the date nominations are made, and who has not been an employee of the association or any of its units during the 2-year period prior to the date nominations are made, and is affiliated with a local unit, shall be eligible to be nominated, elected, and serve on the board of directors. Consent forms may be requested by email at ballot@naacpnet.org by submitting a request for consent to the Election Supervisory Committee. Consent forms may be requested from the Election Supervisory Committee by email at ballot@naacpnet.org. Following the chairman's address on the opening session of the convention on Sunday, September the 13th, 2020, to be considered by the committee. All consent forms must be submitted no later than 10 a.m. on the Monday, September the 21st, 2020 deadline. Election Supervisory Committee receive consent forms and petitions, email at ballot@naacpnet.org. Voting shall be conducted by secret ballot before the annual resolution session. Voting will commence on Saturday, September the 26th. All voting delegates to the convention are eligible to vote and will be authenticated through the process assigned for registered delegates. The nominee who wins 50% plus one of the ballot cast will be declared the winner. Any voter needing assistance will be assisted by a member of the Election Supervisory Committee or designee.
Hello, I am Valerie Hollingsworth Baker, the International Centennial President of Zeta Phi Beta Sorority Incorporated. I am delivering an important message to you and your family about the current economic crisis affecting Black women. The COVID-19 pandemic has had a devastating impact worldwide, causing unprecedented increases of unemployment, food insecurity, digital and internet inequities, and death. In April, the unemployment rate grew by 10.3%, serving as the largest one-month increase in history. Black women comprise 60% of America's labor force and have suffered the greatest job losses at a rate of 16.9% and climbing. Here are some additional key facts. Black women help to sustain our families, often as single heads of our households. We are essential personnel on the front lines, and we are the fastest growing population of new business owners. Sadly, however, we are least likely to receive capital resources to develop our individual entrepreneurial skills and business ventures. Although Black women play a critical role in sustaining the U.S. economy, we still experience wage inequity, higher rates of unemployment, and are underrepresented in senior leadership roles in the workplace. Now more than ever, there is a need for a more inclusive economic narrative that prioritizes Black women. Collectively, we must urge our legislators to institute economic policies that, number one, address the unique and significant economic needs and challenges faced by Black women. Number two, provide resources to Black women to help strengthen their entrepreneurial endeavors. And three, aid those that have been negatively impacted by COVID-19. Zeta Phi Beta Sorority Incorporated, an international service organization, is at the forefront of creating programs that promote economic empowerment for the communities we serve. Zeta has partnered with D Free to promote financial freedom. Together, our groundbreaking organizations will provide our communities with the tools needed to eliminate debt and encourage financial savings. It is my hope that the NAACP will join the ladies of Zeta Phi Beta Sorority Incorporated in our efforts to help eradicate economic barriers for Black women and our families.
Good evening, and welcome once again to the 111th NAACP National Conference virtually. Our session is called Beyond the Barriers, a new agenda for Black health and wealth in America. My name is Sharice West Scantleberry. I am president and CEO of the Winthrop Rockefeller Foundation, which is headquartered in Little Rock, Arkansas. And I have the privilege of being your moderator this evening. So what I want to do this evening is have a discussion. The convergence of COVID-19 and its impact on health and the economy has illuminated the disparities that are rampant across our society. The recent national awakening following the realities of racial discrimination has provided a unique opportunity to examine, discuss, and offer transformative solutions. The NAACP continues its longstanding advocacy to demand the elimination of health and economic barriers that have hindered our progress. This evening, I want to discuss with Gail Christopher, Dr. Richard Besser, and Derek Johnson, who I will talk to you a bit more about in a second. I want to have a discussion with these experts on what measures our communities must advocate for in order to empower, educate, and amplify investment in Black health, Black businesses, and Black communities. So this evening, we will have opening remarks by Dr. Gail Christopher. Following those remarks, we will have a discussion with Dr. Besser, who is president of the Robert Wood Johnson Foundation, and Derek Johnson, who is president and CEO of the NAACP. So let me tell you a bit more about each. Dr. Gail Christopher is the executive director of the National Collaborative for Healthy Equity, the National Collaborative for Health Equity. Dr. Christopher is an award-winning social change agent with expertise in the social determinants of health and well-being and related public policies. She is known throughout everywhere, internationally. She may not agree to that, but I love her. She is known everywhere for her pioneering work in truth, racial healing, and transformation. So Dr. Christopher will start us off with some opening remarks. Once she's done, Dr. Richard Besser, who is the president and CEO of the Robert Wood Johnson Foundation, in a position he assumed in April of 2017. He is the former acting director for the Center for Disease Control and Prevention and ABC's News, former chief health and medical editor. He and myself and Derek Johnson, again, who I said is as we know, is the president of the NAACP, will then engage in a discussion. So, Dr. Christopher, I want to turn it over to you to kick us off.
Thank you, Cherise. I am honored to have been invited to be part of this wonderful panel and to be part of this convention for this NAACP organization. I wish more people understood how much this organization has done to assure progress and justice and equity for African Americans and people of color. I do think, though, we really have to ask ourselves seriously, why is it necessary to have an organization to advance opportunity and equity for people of color? It's necessary because our country was built on a false premise, an ideology of a hierarchy of human value that denied opportunity, and that's the least that it's done for people of color. And so this moment, people call it a reckoning, they call it an awakening. This moment could be transformational, I believe, if we come to grips with the fundamental undergirding premise, the fallacy of a hierarchy of human value, and commit ourselves to getting rid of that. Not just addressing the consequences of that, but to actually get rid of the fallacy itself and replace it, to change our culture, to create a culture in America that truly acknowledges and honors and respects all people equally and recognizes our sacred interconnectedness and interdependence. There is so much about COVID that has pushed us beyond denial of our interrelatedness and interdependence. When hospital beds are full, there are no beds for anyone. And this moment is forcing us to see that we do matter to one another, even though we may live very far apart. When the sun was discolored in Washington due to the fires in California, Washington, D.C., due to the fires in California, it was another reminder of how we are interconnected and interdependent. But we've built this society with a different view of each other. And it is time for us to develop the skills and capacities that a democracy requires. Democracy, a viable democracy, requires high capacities for empathy, for compassion, for perspective taking, and a willingness to engage with one another in constructive ways. And I think this is a moment where our country has to galvanize all of its resources for those types of purposes. Now, I call that healing. Some people would call it justice. Some people would call it working for equity. But I honestly believe that we have to be in this together to achieve our goals. The adversarial dynamics that seem to be the dominant ethos, the dominant theme, it's just not going to get us there. I've lived long enough to know that the more fuel you give to fire, the bigger that fire gets. And so we really do have to learn as a country how to face our past, and how to heal from it, how to acknowledge it, and how to move forward together. I think that is our challenge. And if we're going to truly remove the barriers, if we're going to change this persistent reality of disproportionate infant mortality among children of color, of disproportionate concentrated poverty and residential segregation, so many of the things that drive illness and poor health, if we're going to change those realities, it's going to have to be because we as a country made it a priority. We've tried it by just having, interest groups step up and continue to do work, but it's time for a comprehensive, unified effort. Now, I may sound a little Pollyannish, but you've got to have vision in order to get to where we need to be, and I believe it's possible. I believe there are more people in this country who care about this country's future and want it to be one that is equitable and fair for all people. That's what this organization has stood for since its inception, and it has galvanized allies and support, the likes of which, the story just isn't told broadly enough. But the more I read about the NAACP and its local work, the people who gave up their lives so that we could have the vote, the way the fight was waged for integration of schools, there's so much this organization has done. And I believe it has a role to play in helping us to really sort of turn that corner toward a country that has faced its truth, that has healed from its divided past, and has stepped forward together into a transformed future. There was an article published recently. I'm not one of those people that sends out articles to all my friends, but this one just stopped me in my tracks. And it was published by the National Academy of Sciences, and they did this amazing look at the data of birth outcomes in the state of Florida. They looked at 1.8 million births over, I believe it was a 12-year period, and they analyzed the outcomes, and they compared the outcomes for babies who were delivered by white physicians and babies who were delivered by Black physicians. If they were Black babies delivered by Black physicians, they had a 50% less likelihood of infant mortality. Now, just sit with that. What they call the infant death penalty for Black babies would be reduced by 50%, was reduced by 50% when a doctor of the same race delivered the baby. They called it physician-patient concordance. What is it? That these babies certainly aren't trusting these doctors more. These babies aren't communicating differently with these doctors. What is it that's happening that's changing the dynamic? It warrants further research, but it certainly has to do with decisions that are being made by those doctors that may be fueled by conscious and indeed unconscious bias. I have talked with neonatologists and pediatricians of color, and long before I read this article, they shared stories with me about decisions they made that their colleagues might not have made that saved the lives of Black infants. So this disproportionate death penalty that we see at birth, and then we see it throughout the life course, most visibly recently at the hands of police, this is, I believe, a direct result of our country's continued adherence to a false premise of a hierarchy of human value. We must learn to value one another equally, but the operative word there is learn. It's gonna take work. We've all been part of this system that devalues one another. And so there are concrete skills and aptitudes that we have to decide to develop. And we certainly have to have them developed in all of those who hold life and death decisions in their hands, be they medical doctors or police officers or educators, indeed, politicians, elected officials, leaders of nonprofits, philanthropic leaders. We all, I think, should hold ourselves accountable to test our capacity to see ourselves in the face of the other. As I draw to a close, I just want to share a brief story. You know, I was blessed to become a grandmother recently. And I was there at the waiting room, you know, so excited to see my baby. It was a surgical delivery, so I couldn't be in the room when the baby was delivered. My son-in-law came out and he was all excited and he said, everything's fine, but I just have to prepare you. And I was sort of like, prepare me? He said, yes, the baby is very pink. And I was like, okay. Well, you see, this was an interracial marriage. And we had convinced ourselves that this was going to be our beautiful brown baby. And he really knew he needed to prepare me that this baby was very pink. I share that story. Of course, when I held my baby, he was perfect in every way, and I loved him completely, my grandson. But it was a story, it was a moment that reminded me of how we are so obsessed with this absurd notion of difference and racial hierarchy, and we have to overcome it, not just for ourselves, but now we know that the majority of the children in this country are in fact children of color. And if we are going to remove the barriers to opportunity for these children and have a viable economic future for this country, a prerequisite is us overcoming racism and its legacy. So I'm excited to have been asked to open this conversation. And I know my fellow panelists have very important things to say about the work that we have to do and the work they are doing and supporting. So thank you, Cherise.
Thank you, and brilliant analysis as always. So you gave us the call to action, and we understand what the prerequisite is. But what is the how? What is the how? Can you talk a bit more about the how?
I will. Thank you for that invitation to do that. In my experience, and I've been doing this now for more than 40 years, the literature, my experience and the literature, it does tell us that overcoming bias, at least on the interpersonal level, and challenging our stereotypical perceptions is enhanced or made possible through direct interaction with the perceived other. And various ways to do that. I think actually this moment of increased engagement virtually may accelerate our opportunity to do that work, to bring diverse people together. But whether it's through racial healing circles or classroom integration or workplace dynamics, when we are forced or enabled to interact with diverse people, it helps to challenge our stereotypes and our biases. So that is a part of the how. As you know, the Truth, Racial Healing, and Transformation framework for this adaptation of the truth and reconciliation process that is globally recognized, we actually came up with 5 key components for the work. And the first component of the work is to change our collective narrative about who we are as a country, and to influence those instruments that pervade that narrative on a consistent basis. And we are particularly charged to get a grip on social media, which is of course only serving in many ways to divide us right now. So I think that's a particular challenge. But the narrative that says who we are, we've seen amazing examples of that only in the last 24 hours. In terms of the resistance to a more comprehensive, truthful narrative of who we are and how we came to be who we are. But narrative work is critical, and it involves many, many sectors. And then there's that work I was just describing in terms of bringing people together so that they develop the skills and the capacities for empathy and perspective taking and compassion. Self-compassion is a prerequisite to compassion. You can't give what you don't have. So there are opportunities for that sort of training and engagement, and it needs to happen exponentially around this country. But then we asked ourselves, well, if racial hierarchy is a fallacy, and genomic science tells us this, anthropology tells us this, how on earth has it been maintained, this idea of a hierarchy of human value? How have we maintained it for centuries? And we came up with 3 answers to that question. The first is through separation. And you know, government sanctioned, imposed residential segregation is a key element there. and segregation remains the driver of health inequity and education inequity and lack of opportunity for employment and lack of opportunity for safety. So separation is critical. It's also in the form of Native American reservations, the cradle to prison pipeline, the list goes on and on. We have to have specific strategies to overcome separation. But this idea of maintaining a hierarchy, it was codified into our legal systems and into our systems of governance. And so part of the framework says we have to re-examine those systems. We have to identify where we are reinforcing this, and voter registration is just one example. What percentage of our Supreme Court decisions have been fueled by this issue of racial hierarchy? So this is work that needs to be done to address the legal codification and the oppression that is guaranteed and enforced by our legal systems, in some cases, our police systems. And then finally, of course, the last element of the five-part framework is the economy. The systems of racial hierarchy are designed to maintain that hierarchy through economic exploitation. And so redesigning our economy in this moment where we are called to do that, to redesign our economy as a result of COVID-19, redesigning our economy that really does respect and honor the essential workers, that's the opportunity that we face right now. So the how is bringing together multiple sectors of people to actually take on this work. And I'll finish, Sharice, by saying that each of those elements of that framework begins with envisioning a future. So what is our vision for a true narrative of America? You know, what is our vision for how we relate? We have yet as a country to even envision a country without racism. And so a part of the work is that it is bringing the critical mass of people together, motivating them to envision a future when we have put racism behind us.
Rich, when you hear that, let me get some of your thoughts about the envisioning, but more specifically, you know, we're charged with talking about Black health and wealth, a new agenda. Like, how do we reimagine a new agenda? One question I have for you is, like, what is that link between wealth and health? If you would walk us through that link. And then, you know, how do we, in the structure and the systems that Gail just described, like, how do we even begin to reimagine a new agenda for Black health and wealth in our communities? Rich, you have to unmute.
Thank you. First thing I want to say is, Gail, I could listen to you all night because every time I hear you speak, I learn so much. That was absolutely wonderful. And picking up on some points that you made that are really relevant. One of the things when it comes to health is changing the narrative and the mindset around what it takes to be healthy in America. There's this idea that health in America is about health care. And yes, it's really important. Everyone in America should have access to high quality, affordable, comprehensive health care. We all need that. And at the start of the pandemic, 28 million people didn't have that. But Gail lifted up the factors that really drive health in America. And so much has to do with the community in which you live and the opportunities that are there. Sharice, you asked me a comment on issues of wealth, and you know, in America, the wealth disparity between Black Americans and white Americans, it's tenfold, and that comes out of intentional practices over the course of our history. It's so much related to issues of housing and intentional segregation. And in America, so much of wealth accumulation has come about from home ownership and the ability to put money into a home and build wealth that way. And government policies intentionally block the path for Black Americans to home ownership and wealth accrual. You know, when you look at the data, it makes it pretty clear the importance of place. And the Robert Wood Johnson Foundation, we funded the development of maps that will provide information on life expectancy by every census tract in America. And I'm right now sitting in Princeton, New Jersey. That's where our foundation is. That's where I live. It's a predominantly white town. I grew up here. Life expectancy for a child born here is 87 years. I'm a pediatrician and I volunteer in a clinic in Trenton, New Jersey, which is in the same county. It's 14 miles from where I am. And life expectancy, it's a predominantly Black community. Life expectancy near my clinic there is 73 years. So you have a 14-year difference in life expectancy over 14 miles of travel. And so, what's that due to? So much has to do with the opportunity that is either there for some or the barriers that are there for others. The quality of education, the access to jobs and transportation systems, the quality of the environment. Where do you allow environmental toxins to exist and where do you prevent that? Those factors weigh in a big way in terms of people's life expectancy. And the current crises that we are facing in America around COVID, around the economic downturn, around racism in America, they all point to the same factors, and it makes it clear, and it provides a moment in time where it's impossible to ignore. If you look at the disparate impact of this current health crisis in America, and the fact that Black Americans are dying at 3, 4, 5 times the rate of white Americans. Black children, Latino children, Native American children, making up 75% of the deaths in children. You have to explore the why behind that. And a lot has to do with exposure and who works in jobs that allow them to work from home and who is more likely to be essential workers in our country, who is more likely to live in settings with multi-generational households or more crowding in households. So if they're exposed, more likely to spread COVID within households. These factors shine a bright light on the impact of structural racism, on the impact of interpersonal racism, as Gail was laying out in terms of the increased mortality rate among Black babies in America. These are things that you can't ignore, and there is a path forward to dismantling these systems. And will we treat this as an inflection point in our history and work to tackle these issues? That's what gives me some sense of hope. Is that you can't ignore it. To ignore it would be absolutely cruel at this moment.
And Derek and Rich, what do we do? We kind of know what the challenge or what the problem is, but the conversation is, how do we create a new agenda? Like, what can communities actually begin doing?
So I would just start by saying, first of all, thank you all for joining the panel. Much of what we see in society is a combination of how we see one another and the public policy that is informed from there. As we look at the protests in the street, it truly do look like America. And that's a positive thing. And they are in the streets on a value proposition that Black lives matter. Not that anyone else's lives any less, but Black lives matter. And the reason why that's important, that factual statement, not a hashtag, not an organization, a factual statement, because far too often the public policy have been driven in ways in which people are being disregarded because of the racial construct that we fall under, which is a political racial construct. And that's all about public policy. Many of the individuals that we come encounter to who are now considered white were not always considered white because it was not the political thing to do. It was only a shift in that reality when the white Anglo-Saxon Protestant classification became the minority in terms of their voting dominance, and as a way to maintain levels of control of governance in a democracy, they began to increase those who would be classified as white. So if you think about the 30s and the 40s, the Jewish community was not considered white. The Irish communities was not considered white. It's all a social construct, and it's all based in public policy. And so then the second part is, well, how do you impact public policy? Well, moving those peaceful protesters that are in the street, stating that factual reframe that Black Lives Matter, and move to the power of the ballot box. Our vote is our currency, and if we collectively leverage our vote behind a value proposition, not only that Black Lives Matter, that this racial construct that has been formed by public policy for decades, centuries, should no longer be the reality. And decoupling the concept of white supremacy from democracy. For far too long, our democracy have been hamstrung with concepts of white supremacy. If we are able to do that effectively in November, we can set a new value proposition with policymakers who are elected and understand that they are put in office to do something different, which then goes to public policy. Public policy to address the structural racism that we see, public policy to address the inequities that are embedded not only against African Americans, but Native Americans and many other communities. What's happening now in this society against women, particularly trans women, is appalling. They are being murdered and no one is saying anything. We have to address those inequities because all of us are a part of a social contract. The social contract is embedded in our Constitution, that men and women are created equally and endowed with certain inalienable rights. And until we make that a true contract that's afforded to all of our citizens and a true moral arc that's afforded to everyone, citizens and non-citizens alike, we're going to find ourselves continuing on this treadmill. So what can we do? Understand the value proposition in the reframe Black Lives Matter that's being shouted in the streets by individuals who may not be in the Black community, taking that value proposition to the ballot box in November and informing a lineup of policymakers who are ready to implement public policy to address the systemic deficits and inequities that's embedded in society today.
No, that's perfect. What bold, impactful, big, bold idea can we do to address this? And I'm not saying voting isn't a big, bold idea. And I'm not suggesting that, understanding the construct of race and structural racism, institutional racism, interpersonal racism are absolutely the foundational and absolutely important. But for those who are listening, who are just hungry for a kernel of a big, bold idea, what do the three of you have been thinking? Like if you could have your public policy way, or if communities were able to do the 5 things that you said, Gail, like what is that big, bold idea of changing the narrative, or bringing people together, or Rich, as you said, really examining the why behind the disparities? Like what are some big, bold ideas?
Well, I looked at how my family that grew up in really just abject poverty in Alabama, my mother, my father in Virginia, and how they turned themselves into middle-class, highly educated people. And the route was through employment. The route was through economic opportunity. And so I think the bold thing we could do is to make sure that that is an option that is available to everyone. To redesign our economic system so that a living wage and an opportunity for gainful employment is available to everyone that needs it. We really have to get past these silly debates about, is it in the best interest of the business to pay a living wage? But I really, that's really the best anti-poverty program we could have, is to provide economic opportunity, and to do it in a very intentional and concerted way. And if we really added up what this racial hierarchy is costing our economy, from the healthcare costs to the lack of tax revenues to the criminal justice system, I mean, the money that we are spending needlessly because of racial injustice and inequity could easily pay for a more balanced opportunity structure and an economic one. So I think if I had to pull the lever and make the decision as to what we could do that would bring about the fastest return, and make the difference boldly, I would say it would be the economic opportunity.
Rich, and especially from philanthropy, like what is the boldest thing we can do?
I think a number of things. When we think about how we want to approach issues of health equity and racial equity, we look at a number of things. We look at mindset shift. How do you change people's mindsets and the narrative around why different groups in our society do worse off in terms of health? We want to work towards community empowerment and providing the resources so that those in communities can affect the changes that they know are needed in their communities to see progress. And then we look at policies, and the one that Gail just lifted up in terms of living wage is absolutely critical. Looking at wealth disparities and how do you approach the gap in wealth that is so critically important. I know that I have benefited from a system that provides privileges to people like me, like heterosexual white men in America. And how do you look at that, and how do you question that and shine a light on that so you can see where there has been advantage and where there have been barriers. But they're when you talk about something big and bold, we tend to go a little incremental, and I wouldn't discount the value of incremental. And so when I talk incremental, I'm talking about something like universal health care. What would it look like in America if everyone had access to high quality, affordable, comprehensive health care like most wealthy nations provide, or everyone had sick leave and family medical leave, or half of the lowest paid workers in America, which have a higher proportion of people of color, aren't in jobs where they have sick leave or family medical. And so many people in America don't have unemployment insurance. So, these are some things that
Rich,
old, but they are absolutely essential.
But they're also, as you know, our counterparts would say, is socialism and costly and all kinds of other attachments to it. How would you respond to those?
Well, we talk about America as this land of opportunity and liberty and justice for all. And these are aspirational values. But the idea that in the wealthiest nation in the world, how you do if you get sick depends on whether you have health insurance, and just by the accident of history that our health insurance system is tied to employment, it makes absolutely no sense. The Affordable Care Act was taking us a step in the right direction, but there's still 14 states that haven't expanded Medicaid coverage. And those are the states that have the highest proportion of African Americans. And so when you have a situation like this of a health crisis, you're seeing the greatest burden there. So you can make the case in terms of fairness. You can make the case based on the purported American values that we want to be living up to. I don't think it's socialism to say that in the wealthiest nation in this land, people should have access to health care. I mean, who wouldn't want that for their own children, for their own family? And the idea that someone in your family is sick and you can't take time off work to take care of them, or in a time like COVID, where you don't have sick leave, and you think you may have symptoms of COVID, and you have to make the choice: do I stay home so that I may not expose other people, or do I go to work so I can put food on the table and pay the rent? That's a choice that no one should have to make. But in America, there are millions of people who have to make similar types of choices every single day.
Thank you. Derek, what is that bold idea that the NAACP has been talking about, or what you're seeing as you talk to your chapter members?
Bold idea, we have to look at what has worked before and then go bigger than that. We need to truly address the student loan crisis that's in this debilitating to so many individuals. We need to prioritize the teaching profession, create a higher standard, and provide additional pay. We need to completely gut and redo our taxing structure so that we have a taxing system that's consistent with a value proposition that all of us matter. We need to create a far-reaching jobs program to rebuild our infrastructure and prioritize communities that have been left out in the past. My family, sound like Gail family, migrated to the north for good jobs, and they were good jobs because they were union jobs and they paid a livable wage, and many of them paid beyond livable wage. They were blue collar jobs. We need to create a new economy to allow people to be gainfully employed, and ways in which we can look at what is Germany doing that's different with their work council model, and they're starting young people in the 8th grade as they guide them through a profession. Whether they go to college or not is a choice, but the reality is they all have an opportunity to be gainfully employed. There are models and examples around the globe that we need to look at. What's working in Finland with education? What's working in Japan around economic stability? All of those lessons are right there. The bold things we can do have all been researched and studied. We can pull research paper from University of Michigan, Brookings, you name the institution, and that can be the set of bold things that can be done.
So what is the frustration, or what prevents us? Gail, you were about to speak. Like
Yeah,
like what prevents that? It's not that deep, right?
Yeah, that's where I was gonna go. Derek said we, Rich said we, I said we, your question said we. And to me, that's the operative space. How do we get to a critical mass of we, and lift these issues up beyond the political divisions and the legacy that is. Our politics have been so racialized for so long. They used to call it dog whistle politics. Now it's a bullhorn. But the racism that is embedded in our political history and in our our red and blue states dynamic, and our states who have expanded Medicaid and those who haven't. So much of this is the need for the healing work that helps us to get to a place of civic engagement around this we. Who is the we? And how do we nurture and support and expand and ultimately believe in the we, believe in us? That sounds like soft work, but I believe it's absolutely necessary work. And as Derek was saying, other countries have tried to do this. Many of those societies that have a stronger social safety net have, prior to the recent immigration and refugee change, have been homogenous societies racially. And so, they've been more willing to care fully for the people. We have to recognize that our legacy and our diversity, while it is ultimately, I believe, our strength as a country, it has also been the dividing factor that keeps us from being we, from being us, in an expansive enough way to have a critical mass for the kinds of changes that we need to make. Policies, I lived through the Obama era with such enthusiasm for some of the policy changes that we were able to put in place, only to watch them be reversed one by one in a subsequent administration. And so while I concur that policy is where we have to live, it's the we. How do we get to the we, and how do we become intentional about that work and move ourselves beyond the current political and social divisions that are being manipulated?
Derek, how would you respond to that? Because when we think about leadership around this we think of institutions like the NAACP.
I absolutely agree. It has to be a we, and it has to be a level of organizational responsibility. Organizations like NAACP, 111 years old, we have to transform ourselves over time to keep up with the times in ways in which we not only understand the we, but the accountability, responsibility to our volunteer members across the country to lead the discussion from behind and not trying to send edicts down from above. That's really important in terms of organizing and working with people, respecting and appreciating their lived experience, and understand the leaders in our communities are those who are being impacted and willing to step up and make the change. It is organizations like NAACP, our role is to facilitate those voices, that leadership, because that's where the expertise lie. And for legacy organizations, if we don't transform ourselves and understand that the titles we hold are only the vehicles to lift up true leadership, then we die. And what has happened over time with legacy institutions, we lose sight. For during my tenure, our goal is how do we put the we back into the people, and the people are those who are living through the experience and hear their voices, because that's where the expertise truly lies.
Rich, would you weigh in on this, and also talk about other institutions? Like, where do you see private sector, nonprofits, philanthropy, and the like in this we?
Yeah. Well, I think we have a role to play in terms of trying to help build the we. One of the things that is taking place around the country, which is, I think, very exciting, is challenging the history that so many of us were taught growing up in terms of what is the story in America. I can tell you that when I read the 1619 Project in the New York Times, that sure was a different history than I had growing up. And you know what it says is it really points to the importance of structures and systems in the outcomes for people's lives. And that if we're not going to look at the history of how we got to where we are, we're not going to be able to move forward in a way that we can do as a nation, addressing the history that's so challenging, and making those changes. You know, with the model that I learned as a doctor and a pediatrician around health was really one about personal responsibility, and a model that really focused on teaching people, you know, about eating right and exercising, getting a good night's sleep, talking to parents about what their children needed, and I have to say that, you know, after coming to the Robert Wood Johnson Foundation and learning more about what really drives health, it's shifted my thinking towards a model of one about systems and structures. Because yes, personal choice in health really matters, but the choices that you make depend on the choices that you have. And for so many in America, those choices aren't the healthy choices. So there's this reframing that has to come by helping people to learn. And yeah, not everyone's going to want to step up and learn, but there are a lot of people, there are a lot of allies or potential allies who lack the information and need to dive into on that learning journey. You know, as Gail was talking about the racial hierarchy, it struck me right in line with a new book by Isabel Wilkerson on caste. And it's a great way to understand the history of racial hierarchy and where that comes from. But if you're not willing to dive in and challenge that, you kind of look at, well, yeah, racial hierarchy. Well, the intentionality behind it and the systems and the way it's been reinforced over our history, there can be movement towards we by reaching a shared understanding. And so efforts, recent efforts over the past few days to try and block some changes to what's taught in schools is just anathema to what we're trying to talk about here, because shared understanding has to come from some sense of a shared history and an understanding of what our nation was built on and the mythology that we've been taught, rather than the truth of our history. And I think, you know, that healing comes about by understanding that. It doesn't matter, you know, my relatives didn't come here in 400 years ago, but they came here to a system that put their place in the hierarchy pretty high up. And so this idea that you know, anyone can make it in America, you can pull yourself up by your bootstraps, understanding our true history and the reinforcement of racial hierarchy is absolutely essential if we're going to make progress in dismantling the system.
Well, I fully agree. As we know, we all have friends and family who would say, that was not me, that was them, that was another time. And I don't understand why right now you don't just go to school, get an education, get you a job, and I'm not holding you back. I don't get what your problem is. So while I subscribe to everything that's being said on this call, I also live where I live and sit where I sit in this country and hear this conversation often. And you don't have to respond to each tidbit because that's not so important for this. As it is, as we talk about reimagining and being bold and this new agenda, it's equipping ourselves with the history, knowing that leadership is important, knowing that we need to change the narrative, bring people together, all of that is true and there. But if I'm sitting in my living room, in the middle of an urban or rural community, and I plan to vote, and I am going to do all that you say, but I still don't feel empowered that I can do something against this structure and this hierarchy and this place that we live. So what would you do with me if I were that person, or I am that person,
So, this civil rights songs, freedom is a constant struggle. So also the part of the reality that movements oftentimes start with a few and the masses join. And that's how things are ignited. And there's also the fact that is always ordinary people who have the courage to do extraordinary things. And it's a matter of linking all of those things together, knowing that it's a constant struggle, nothing is perfect, there's ongoing work, that you could be a local leader in a rural community, a regular person in an urban community, but we all have that capacity to do some extraordinary things. Recognizing that it takes courage or the ability to overcome your fear to actually link up with others to do the same. There isn't a magic bullet to make it happen, but there's a lot of lessons to learn from the past that we can look to see inflection points. And I'm glad, Rich, you mentioned is Joe Wilkins' book, Cast. For that person you was talking about, Sharice, who's like, why don't you just do like I did? That's a good study to understand how pervasive the social construct of race is in this country. And the way she was able to weave in the historical realities of India and relate it back here and tie it all together around the race power dynamic is something I would encourage not only African Americans to read, I think everyone should read. Because if we all begin from a set of facts or understanding, it can open up the ability for us to communicate and hear one another. Right now, people are talking past one another. And that largely because information is so democratized, we can exist in the same neighborhood and not see facts the same because there is no center of gravity for facts anymore. If I wake up every morning, I'm listening to Rush Limbaugh, and then I look at Fox News, and I go to bed, and before I listen to the Gus Savage show, my perspective on reality is very different than someone who's waking up looking at just CNN and listening to NPR. It's a different worldview because there is no common set of facts. So once we get past this moment of social media that has really created a democratized media source and figure out how to get at the center of gravity of facts again, then we can get to the weeds, then we can get to the structural damage and the repairs, then we can get to the institutional opportunities.
Go ahead, Gail. I was going to say that requires leadership.
Yeah, it requires leadership, and with all due appreciation and respect for everything, I agree with everything you said, Derek and Rich. The element I think that's missing from the conversation is how much of this is really the work of the heart. Mm-hmm. It is the work of facts and reason and logic and all of that. But ultimately, what drives the courage, and what drives the determination, it's from the heart. There's a wonderful book called Fire in the Heart that describes some authentic stories of people who were not people of color, but who got it and devoted their lives to trying to change racial hierarchy, right? there are ways to connect people at a heart level. And when that heart becomes ignited with the passion for fairness and justice, and I dare say love of humanity in the spiritual sense, then you've galvanized a willingness to move that all the noise just can't stop. And so I think we have to, get away from false dichotomies. It's not head or heart, it's both. But we can't leave out the heart piece. And from the spirituals of this that drove the civil rights marchers to those things that make us feel like we really can do this. So much of that is hard work. And I spent a lot of time figuring that out and seeing and experiencing transformation in people at a heart level. And once that happens, you can't take it away. It is definitely a change that will last.
Thank you. So we have just a few moments left. And as we close, a new agenda for Black health and wealth. What are your 2 top pieces of advice or call to action? And I'll start with you, Rich.
I think that the COVID pandemic needs to be an inflection point in our history, and we need to take what's being seen here and the lessons from this, and move for the policy changes that could change the trajectory for our nation. It's said that you should never let a crisis go to waste. And there's never been a public health crisis like this in my life. And we have to look at all of our institutions and build in racial equity and racial justice. I think Gail's call to the heart is so important because, if you can capture the heart, then the head will follow. I'm on the media many times a day talking about COVID and what needs to take place, and some is conservative media and some is more liberal media, and the narratives are extremely different. But I think there is that opportunity to bring together if you can capture people at the heart and see the humanity in each other.
Thank you. A new agenda for Black health and wealth. Derek, I'm going to come to you. Your 2 items or call to actions, or what do you think we should do?
Sharice, I want to use the example that we went through in response of Katrina, and recognize that health has to also include mental health, because there were so many people who were devastated, who was actually heroes, but who care for the caregiver. And many of those caregivers who stood up, and local leaders, within 2 years, a lot of them actually are no longer with us because the devastation of what took place. And we have to put a priority on mental health in ways in which it gains more emphasis. I believe much of the substance abuse across the country is a result of a weak mental health system, because people are trying to figure out how to cope with a reality that they can't seem to get their arms around. Now, the question of wealth is more than just money. It's the ability to be valued, valued for who you are, valued for what you add, and the ability to be equipped to add value to society. And so, as much as we can create wealth by giving people to add value, that can increase the wealth of so many people in so many communities. And as much as we talk about health, we really accelerate the need for mental health support, so that we can cope with this moment and grow out of it and be stronger, both much more healthier mentally, much more wealthier, because we can add value.
Excellent. Thank you. And Gail, a new agenda for Black health and wealth. What is your either best couple of pieces of advice or call to action?
Given the timing, I think the most important advice I can give is to vote, and to make sure that everybody that you care about, know about, and connect with also votes. I think that is the most critical consideration at this moment in time. I would also follow, I believe very much in the power of visualization. And so I'm turning off NPR and MSNBC and anything else that would drive my personal narrative. And I'm imagining the outcome I want to see on Inauguration Day. And I am looking at that picture and creating it in my mind every day. And I would encourage people to do that too.
Well, I want to thank you all so very much. This was a great conversation. And I thank you for sharing your wisdom, your advice, and your heart. And the one couple of takeaways, but the one definitely is that we have to work on the we. I want to thank you all for joining us this evening for the 111th NAACP National Convention. #We are done dying. Have a great evening.